Minnesota does continue to have some of the highest COVID-19 vaccination rates in the United States, but in recent weeks, it's also had some of the highest COVID case numbers.
Last week, a conversation was held on how the pandemic has unfolded in rural Minnesota. And joining us this morning, Julie Tesch, the CEO and president of the Center for Rural Policy and Development, and Andrea Roberts, the president of the Minnesota Association of Nurse Anesthetists. Thank you for both being with us this morning.
Thank you for having us.
Julie, let's start with you. You guys held this webinar last week. Tell us what you learned from this, kind of the idea behind it and what you were hoping to glean.
We were approached by an organization called the COVID Collaborative, which is a nationwide organization to host a webinar on rural COVID issues. And so we were happy to be that convener. And so we had about 300 people for the webinar that were interested in what is going on in rural Minnesota with COVID, whether it's vaccines, testing, just everything in general. But you know, the thing that I learned the most from that is that there's so many people involved and it is a real team effort. So we had the chief of police from the city of Wyoming, we had a minister from St. Cloud, we had a county administrator from Alexandria, and a farmer, and a couple others. And so it was just wonderful to have a nice broad group of people to listen to and learn from.
I think it really goes to show how COVID has impacted literally everybody and every entity.
Absolutely. You know, hearing from law enforcement and from faith leaders, I thought was just fantastic because you don't hear from them as often. And just hearing about how they approach COVID and how they approach their workers, how they approach their members of their churches was just really fascinating.
Well, I know one of the things the pastor was talking about is his ability to influence his congregation by continuing to have a conversation and really keep that dialogue going, because that seems to be one of the hardest things here is maybe people who've sort of stopped listening, and you really got to keep going with it. Andrea, from your perspective, inside hospitals, inside healthcare facilities, paint a picture of what things are like every day.
Things are emotional and they're rough, and I think healthcare workers are tired, they're fatigued. In the bigger hospitals, you're seeing beds that are full of COVID patients. In the rural hospitals, you're seeing us transfer those sicker patients, but what we're left with is taking higher acuity patients ourselves to fill the void that we would normally send. But in a rural setting, what we're doing is we're taking care of people we go to the grocery store with, people we go to church with, our colleagues' families, and that puts a separate responsibility on you. And so I think education is key. You know, we know to socially distance, we know to mask up, keep yourself healthy physically and mentally, get vaccinated, get that booster. With Christmas coming upon us, we all are tired of being apart and we want to be together. So let's do it safe so we can do it more, so we can do that next year as well. It's important to have that conversation, start where they are. Not everybody wants to be told what to do. And so have that respectful dialogue, listen, and ask those questions.
I think that's a really important point to bring up, is that respectful dialogue, because in the beginning it was this thing with COVID where you couldn't really ask somebody if they were vaccinated. You were afraid at what that was going to be like, and now it's like you don't even want to ask people, have you been boosted? Or, you know what I mean? It is a delicate conversation to have, but one that's so important to have. How do you address that with patients? How are you recommending that the staff address that with people?
Listening. Many people just felt that they aren't heard, and they aren't scared necessarily to get the COVID booster or the vaccine. They don't want to be told what to do. And so if you ask the question, how come you don't want to be boosted? Or how come you don't want this? Tell me your reasons, and then truly listen to them, and then you can have a respectful dialogue. If you listen to them, they're going to listen to you as well. And as being leaders in the community, just lead by example. Wear your mask, do those things, and they'll see you, and then they'll model that behavior.
So, Julie, let's talk a little bit about the impacts of the coronavirus crisis in rural Minnesota beyond the healthcare aspect of it. This has had to have had a huge economic impact as well, or other things that maybe folks don't think about. Can you expand on that a little bit?
Sure. Pre-COVID, we already had a workforce shortage. So I know a lot of times we talk about, oh, we need jobs, but even pre-COVID, we needed workers. And now with COVID, with the hospitality industry, with people out being sick, we have an even bigger shortage. And so you're seeing it across the state where, you know, stores are closing early. Mm-hmm. Stores have closed completely. Restaurants are, takeout only or only open on certain days. So it is definitely exacerbated the situation. And we already know that, there's a little less people living in rural Minnesota. And so we need people, quite honestly, to be working.
Well, yeah, and to not have those people, it definitely impacts the services that our communities are able to provide. And so long term, as you look at the next 6 months, year, 5 years, what do you see?
Good question. We need to be recruiting people to move to rural Minnesota. Bottom line. We have so many jobs available, great quality of life, but we need the people. It's as simple as that. We need people to move to greater Minnesota.
Well, we have definitely seen a cultural shift with certain people, sort of quitting their office job and maybe making a move like that. So I guess that if you can convince people to take that step, I mean, there's definitely opportunity there.
There's a lot of opportunity. The two issues are housing and childcare. Just like in the Twin Cities, we have issues with housing and childcare. So if you can find a great house where you want to live in greater Minnesota, that's fantastic.
Wonderful. Julie, Andrea, thank you so much for both coming in and
thanks, ladies.
sharing a little bit of this conversation that y'all had last week. The Center for Rural Policy and Development's webinar on COVID in rural Minnesota is available to watch on demand right now. And we have posted a link on the Minnesota Live Facebook page, minnesotalive.com.